Hi, I'm Dr. Rajani. One thing doesn't make a lot of sense to me, and that is people spend a lot of time, effort, and money on skincare, but they're not sure how to layer it. So I want to clear all that confusion up today. I put my products in front of me, what I use, from serums, hyaluronic acids, to retinols, to growth factors, and just tell you exactly what I do in my clinic for my patients and how I advise them to use it. So it's kind of my program, but it applies to whatever you might have at home. The principles of layering are the same. They're very similar. I know there's a lot of confusion and we're going through it today. Remember to like the videos and subscribe if you find them helpful. One of the most common misconceptions is the pH, and people are wondering about, if I put an acid on something that's a little more basic, will that negate it? More of a worry would be mixing products. So a lot of people say, well, my retinol's too strong, I'm going to mix it with a moisturizer, and I'm going to go through some of those issues today so you don't fall into those traps. To reduce the need for Botox, fillers, collagen stimulators, injections, skincare is amazing and it works, but you have to be on the right stuff. So let's start with cleansing. A lot of people don't want to spend a lot of money on a cleanser. Great. I have no problem with that. Find one that works. I use the Anti-Age cleanser because it has anti-inflammatories, it has moisturizing lipids, it protects the external barrier of the skin, removes makeup. Now, I hear a lot about double cleansing. It means different things, but how I hear about it in my practice is people say, hey, I have acne, I'm double cleansing. That refers to cleansing with the cleanser, letting the skin dry, and then maybe using a medicated cleanser such as a salicylic. And I do like salicylic cleansers. Doing that if you have a problem skin, great. If you have acne, great. For most people, they don't need a double cleanse or use toners. We can get into that in a deeper video when we move along. However, cleansing and removing pollutants twice a day is key because your ingredients are useless if they don't get to where they're going. Absorption is the number one issue that we're sorting out in skincare. Okay, so your skin is now wet after cleansing. What wants water? What wants moisture? And this is your first tip. Cleanse. You don't need a double cleanser tone, but when you still have water on, a hyaluronic acid, for those who like hyaluronic acids, and patients love them, patients in my clinic love them, they get great benefit out of them. I know a lot of people, there's controversy over them. I think small and large particle containing hyaluronic acids, because they're antioxidants as well, patients love that. But you need moisture. So if you're in a dry environment, it poses a problem. But when the face is moist, you apply your serums first, and hyaluronic acid serum is one. So you can leave it moist in that case. If one was to make or want the retinoid to be more potent, or they could take more, maybe they're on a retinol but they could not get a retinoic acid for one reason or another, apply the retinol when the skin is moist to the first layer. So whatever you want to have the most absorption of, whatever you want to accentuate the action of, will be your first layer on moist skin. An exception will be a barrier, and we'll get into that. So that's tip number one. Apply serums as the first step to the moist skin. Hyaluronic acid. Another option would be a vitamin C. Okay, I love vitamin C serums, fresh L-ascorbic acid. Mine is more of a thicker consistency than a true serum, like a hyaluronic acid serum. Nonetheless, it's very light, and that would be applied. So in the morning, cleanse, leave moist, hyaluronic acid, and or vitamin C. And if you use both, it's great. One will not negate the other. Now here's the third step that can get tricky for some people. And it's my second tip, is that everyone needs to be on an AHA, an alpha hydroxy acid. Alpha hydroxy acids work on the outside of the skin, help exfoliate. The squamous cells get stuck down. It creates a barrier for the absorption of everything else you're using. So AHAs help exfoliate. They give brightness because they get rid of those dead cells. They provide a nice canvas for everything else to work, and they've been shown to help build collagen and facilitate. So they do so many things. When you put these on, they'll tingle right away. So it's better to be a second or third layer. And those that can't take it every day don't have to use it every day. They can be used morning or night. So you're still in the morning time. Now your next step will be your sunscreen. And the sunscreen is always the last product. So that's my next tip, is that the last product you place on your face is your barrier product. So if you're using Aquaphor, which I love, for one of many reasons, especially if you've had a recent procedure. If you're using sunscreen, which you should whenever you're exposed to the light, if you're using a petrolatum of any sort, that's your last layer because other things will not absorb through that. So that would be a morning routine for my patient. The sunscreens can be very moisturizing. If it isn't, or someone's not wearing sunscreen for one reason or another, an ultra moisture type of product is absolutely key for many reasons. One is it moisturizes. So a product like this, there's jojoba oil, sunflower seed oil, grape seed oil. It's packed with antioxidants. It's not an active, so it's soothing. And because it emolliates, it gets rid of fine lines and wrinkles. So people look great right after applying it. It's kind of like the ultimate glass skin product. So that is a product that you can use multiple times a day. You can use it morning and evening, but it would be considered a barrier product as well. So it will be among the last step before the sunscreen or instead of the sunscreen if there's no sun exposure. Now, if we go to the evening time, again, important to cleanse, make up everything off. There's a couple choices here for people. If people are using their AHAs in the nighttime, they have oilier skin, go to the AHA. There's BHA in here too, beta hydroxy acid, because people with pores like salicylics, because salicylics go into the pores, they hunt down the sebum, they open and unclog the pore. So AHAs can be used at night, but many people do use their retinols at night. So I talked about the Avenate, the retinol, the retinaldehyde in this form. Those who are my patients will have access to this, which is Plasmatite. That's a 1% retinoic acid, which many of you at home are on. Niacinamide is in here, and there's hyaluronic acid. So it's a combination, but that's an intense product. I can only use that 3 times a week. So when you're thinking of a nighttime routine, you might alternate retinoics, meaning instead of using your AHAs in the morning, your retinoic might be used at night. Now I want to summarize those tips for you so that you get your routine down. Number 1, wet face will improve the absorption of whatever you're putting on, and your serums should be your first step. Number 2, use your AHA regularly. It sets up the skin for absorption for everything else. Number 3 is the double cleanse or the toner isn't necessarily needed by everyone, but it can be your first step if you're adding a salicylic. Number 4, do not mix products. So let's say you had a retinaldehyde or retinol and you're gonna mix it with your moisturizer. So instead of mixing these two together and trying to get the right consistency, you're better off applying, in this case would be your retinol first, apply it, allow it to dry, then apply your moisturizer. So mixing products together is not advised because it's not guaranteed you're going to get them uniform. When you mix them, you might end up with a little more retinol in one part of your container versus another. So you're better off layering those, in my opinion. Finally, the last tip is your barriers, like your sunscreen, your petrolatums, your Aquaphors are going to be last because really not much is going to absorb through there. Now, how do we fit the all-important growth factors in here? This is the anti-age growth factors that I talk about. Remember, there's a serum, one's an accelerator. You wait about 1 minute before applying the accelerator. The serum, as you would expect, is first. Morning or night, they can be applied. And I use these, I recommend to my patients 3 to 4 times a week. You don't need them every single day. If people aren't using retinols, which many people come off of retinols when they find the power growth factors, then certainly use them every day. But if you're still a retinoic acid lover, you can alternate. And they do not interact. So if you're really into it, you wanted to use them both, and your skin could handle it, they won't negate the use of each other. But serums first, meaning I have my patients apply the growth factors first, and then the retinol or retinoic acid after that. I'd be remiss if I didn't talk about home derma rolling, or how do you incorporate that. I recommend that to my patients in the evening. Now there's two ways to use it. If you're using an Anti-Age system, which is the one that I talked about a little bit, that all my patients are on, that's only 0.25. The reason that you're rolling it in is there's a light serum in there and you're looking for absorption. I like people doing that a half hour before bed after cleansing. Apply, roll, apply. The serum is a roller, a light serum, and then go on with your regular routine. 3 times a week for the roller is enough. Many people get away with 1 to 2. See what your skin likes. If you're pretty steady by using the topical creams, once or twice a week with a roller is really what fits into most people's lifestyle and is enough. I put a complete playlist up here for things you can do at home to keep your skin and body beautiful, healthy, and vibrant.